Hello, I am presenting on the topic charcoal cigarette filters and lung cancer. And this presentation is from Muscat et al. 2005. The background to this study is that lung cancer mortality has reached the highest in the eastern interior of the United States. And lung cancer is tobacco is the leading preventable cause of disease and premature deaths in the United States. The authors hypothesized that due to the low rate of lung cancer mortality in Japan compared to the United States, that it's probably due to Japanese preference for cigarettes with charcoal containing filters. And so they looked at the study population of hospital and community based groups in Aichi Prefecture in Japan. And this was a case control study with the eligibility age of 20 to 81 years without previous diagnosis of cancer. The sample size included 396 cases, 224 hospital controls, and 321 community controls. And the hospital staff, physicians, and nurses identified these patients, eligible patients, between 1993 and 1998 from the surgical schedules and admission rosters. The inclusion criteria were again people aged 20 to 81 years who were newly diagnosed with histologically confirmed lung cancer. The exclusion criteria were people who never smoked. This demographics, the variables for this case included both hospital controls and community-based controls, and they had the same eligibility criteria except that the hospital controls were admitted for non-malignant diseases unrelated to cigarette smoking. The community controls were selected based on residential years of living close to the hospital. That's within 5 years of residence close to the hospital. And for the statistical analysis, we have a univariate analysis. All statistical tests were two-sided. For the univariate analysis, effects of residual confounding in smokers who switched from non-filtered to filtered cigarettes was a potential source of error. And we have the univariate analysis included mean and standard deviation. The odds ratio were adjusted for sex, age, and social demographic. The multivariate analysis looked at people who smoked more than one brand in their lifetime, and the main variables were charcoal only or mixed, as opposed to having a plain brand. The results, we have a couple of slides. 90% of both cases and controls were men, which shows the low prevalence of smoking among Japanese women. Controls had a higher level of education, and the most common types of lung cancer were adenocarcinoma, squamous cell carcinoma, and small cell carcinoma. For 73% of subjects, the most recent brand was a charcoal brand, while for 27% it was a plain brand. The overall odds ratio associated with the most recent brand of cigarette was 95% for charcoal versus plain. In a model that substituted years since quitting for pack years and smoking status, the overall odds ratio associated with charcoal filter versus plain was 95%. And in an analysis limited to men only, the odds ratio was again 95%. The mean number of cigarettes smoked per day was 27 for charcoal brands and 24 for plain brands. And there were different bias, but the case control study design was ideal for this hypothesis because lung cancer is a chronic disease. Thank you for listening. These are my